Easily find, book, and manage your travel nursing assignments with the AMN Passport app. Download today. I'd like to write one because it does, because like I said, the care plan nobody reads
Right.
because it's just like ridiculous documentation. But, the summary is a digestible piece of like what happened in the shift that the docs may or may not read. But I'm wondering, like, should I even be like writing that? Or if I do choose to write it, do I need to be more intentional about what I'm writing?
Well, so I would first and foremost, if the hospital policy says that you're supposed to be writing an end of shift note, which I've seen before, then you got to write an end of shift note.
Yeah.
Try to follow that structure. But let's just say there is no policy and your shift was, you're in an intensive care unit. Now, was I going up and down on the pressers? Was I doing all this stuff? And I just want to summarize it in a package because that's what I'm handing off. And I'm saying that's is what I let the other nurse know. You got 2 more runners that you got to go, whatever it is that I'm doing. We're, in the weaning process. The last gas was this. As part of your handoff so that, this is what I told the nurse basically in the handoff was, so there's no mystery. Now, in a med surge unit, or in some of these other units, is that always going to be feasible? It may not be, right? And again, what is the requirement of your unit? And if you're checkboxing stuff and your nursing notes have reflected that, are you double charting? Are you, you know what I mean? But the patient had a fall, and now you're tying this up in a bow. You checked on them, all this stuff. I would be writing a note, but you do have to be careful when it's, especially when it's something that's possibly. This is a litigious society. You're just supposed to be keeping it to the facts. It's a form of communication between the providers. You call the provider, create a note. Something happens, write a note. You do an assessment, write a note. And you can group some of these things together as well that we oftentimes forget about, like some of the stuff that just seems little, but, reposition the patient and group these things together, water, whatever it is that you did, and then make one little, brief note or smart phrase like you reference. If you do the same thing every single time, because you know what that looks like on the big screen, prudency. And you did it. You did it, right? You did it. And you can create some of these smart phrases because if you're doing the same thing all the time, you and I both know that you do.
Yeah.
Then give yourself some credit for that. There's nothing wrong with using that and tailoring it to what you're doing, but you're not copying it and pasting it from another patient from a chart.
Sure,
you see what I mean?
What are some really helpful smart phrases and what are some that you're like, don't write that in your, like we talked about non-compliance,
Continue
what are some
monitoring.
phrases? Yeah, like that. Like what are some that you're like, don't do that, or like this is what you should write instead?
So that you're continuing to monitoring. Really tell me about it. What is it? Clue us in here. Sometimes it's going to be obvious, but why do you feel like you're monitoring what? Now, if you're monitoring the patient's blood pressure because they got 2 beta blockers and their pressure was 100, I'm watching their map. I love it. Monitoring the map, got an order from the doctor, whatever it is. But, you don't have to write that 12 times, though. We know you told me once you got the order and that you're continuing to monitor. I can see you wrote some vital signs. They're staying within that. I think it's great. You held 1 blood pressure medication because you called the doctor again. I think that's great. But stop writing, continue to monitoring. What are you monitoring?
Yeah, like be specific.
Like I told the doctor, that was it.
Yeah.
And
MD notified.
And the patient's struggling to breathe, or that's not how it works. That's not how it works for us. You got to call, you already talked about that. You got to call the rapid. You got to do.
You got to escalate.
Whatever that needs. Yes. And then that's where your Nurse Practice Act comes into effect as well. And they will smack you with that.